Hello, good afternoon, everybody. I'm Dr. Vaishali Joshi, Senior Consultant Gynecologist at Kokilabin Ambani Hospital. My special interest is in high-risk pregnancy and laparoscopic gynae endoscopic surgery. Today, we are going to talk about COVID-19 infection and pregnancy. Uh, last more than 1 year, uh, whole world is experiencing this pandemic, and things are changing so much that not only the virus is changing, the medications are changing, treatments are changing, and there are lot of more avenues there on the market which are giving us hope that we may be ready to combat this deadly problem. The reason of talking to you, everybody, today on this platform is most important thing is to understand what is changing. So this time we are experiencing second wave of COVID-19 infection in India. So इसमें क्या चेंज है, क्या डिफरेंस है जो हम लोग ने लास्ट ईयर एक्सपीरियंस किया है. As you know that it has been recently told and diagnosed that this is mostly because of a third mutant indigenous COVID-19 virus. शायद इसके वजह से इसकी इन्फेक्टिविटी ज़्यादा है. The age group it gets affecting nowadays is younger age group, and infectivity ज़्यादा होने के वजह से the number of cases are increasing rapidly, multiple times than what it was last time. But the good thing is the fatality rate has remained the same, and it is kind of restricted to certain areas where the infectivity and the spreading in the community is high. So this is one important thing. And what other things have changed? So as we know, the symptoms of COVID-19 infections, fever, sore throat, loss of sense of smell, cough, breathlessness, these symptoms are there, but there are additional symptoms, gastrointestinal symptoms like diarrhea or loose motions, feeling drowsy. So these are something which has added extra in this watch list of symptoms. Other things which we have noticing to change is the medication. And जैसे the year has passed, there has been lot of studies, a lot of data coming up that is helping doctors to treat this problem effectively. Meaning हम लोग HCQ ले रहे थे last year. It has been shown that it is of no use. And now we were quite concentrating on remdesivir and favipiravir, these kind of antiviral medicines. But abhi recent studies, WHO has said that remdesivir really doesn't have any role in the early infection. So the things are ever changing, and that is why we want to address these issues today. Particularly with the vaccines on the board, we need to take a right stand and make sure that we all get protected. The government of India has opened the vaccines for all the adults above age of 18. So getting vaccination should be your priority. At least that will protect you from a severe infection. And irrespective whether you are planning a pregnancy, whether you recently had a baby, or to be pregnant woman or to be dad, everybody should go ahead and take the vaccine. Now, the other question is, since it is open for young adults, should a pregnant woman should take the vaccine? ICMR and government in India, it has not been advised that for the pregnant woman. But there in US or in UK, there is sufficient data which is telling us that few of the vaccines can be given safely in pregnancy. For example, Pfizer or Moderna vaccine, which is not yet available, but with the vaccine opening up and new foreign vaccines coming up, they may be available in India after few months. So these vaccines can be safely taken. But even the AstraZeneca vaccine, which is available, which is a counterpart of Covishield, which is available in India, in UK, the Royal College and the UK Health, they are advising of a pregnant woman to for the vaccination. Obviously, this having vaccination in pregnancy is an informed choice of every pregnant woman. And if somebody comes to me with a request for vaccination, one needs to balance the benefits of risk. If this is a healthcare worker who is going to face everyday risk of having COVID infection, and if she is ready to accept the risk, so I would definitely recommend her to go ahead and take the vaccine. So this is very important thing for you to remember. Now, there are other controversial topics like there are different tests which we do in COVID-19 infections in pregnancy. Because the newer infection, the second waves, the RT-PCR may not be always accurate and diagnostic. So sometimes if the pregnant woman is critically ill, then one needs to advise HRCT or chest X-ray. At that point of time, the well-being of the baby also comes into consideration. So at that time, the mother's health is always a priority. So there is no harm going ahead and do this test, as the radiation risks are minimized by modern technology like linear beam screening, abdominal lead shield. So, but it's important to diagnose early detection and early initiation of treatment is very important to prevent the critical illness and bad outcome. So these are the main important changes which are and pattern which we have been noticing in this second wave of COVID-19 infection. So in I think about the antiviral effects, because any antiviral medication, remdesivir, ivermectin, these are not been proved as a safe drug in pregnancy. Then again, here the maternal health comes first. And if the woman needs a treatment, one should go ahead and start the treatment and make sure the proper treatment is given to the pregnant woman. Now coming to how should be the care given in a patient in current scenario. Whether getting pregnant in current scenario, does it mean that this is going to affect the baby? Obviously, मेरे रूटीन डे टू डे प्रैक्टिस में आई थिंक आउट ऑफ 3 पेशेंट ऐसे होते हैं जो इंस्टेड ऑफ बीइंग हैप्पी अबाउट प्रेगनेंसी, दे आर मोर वरीड अबाउट द COVID-19 cases going up and infection risks to the baby. The first thing I always tell them is COVID-19 infection has not been proved to affect the baby's growth. It doesn't cause miscarriages or genetic defects. तो और प्रेग्नेंट स्टेट और गर्भावस्था ये ऐसी चीज नहीं है कि आपको कोविड-19 इन्फेक्शन आके आपको प्रोन करेगा इन्फेक्शन के लिए. You are like any other non-pregnant woman. So what is important is you need to make sure you continue with your healthy lifestyle, stay in a ventilated open spaces. जो भी आजकल के नए एटिकेट, सोशल एटिकेट्स है, यानी मास्किंग, सोशल डिस्टेंसिंग, हैंड सैनिटाइजेशन, ये बहुत क्रूशियल है, ये आपको फॉलो करना चाहिए. आप ओवर क्राउडेड प्लेसेस में नहीं जाना चाहिए. Just make sure that you have some preventive measure, which are not proven 100%, but they are supposed to be helpful, like supplement of folic acid, vitamin C, vitamin D supplement is very, very important to prevent these infections. Now, and you have to continue the social distancing thing. जो अभी रिसेंट डेटा आया है यूके और यूएसए से, उसमें 2-3 चीजें डेफिनेटली हमको पता चली है कि कोविड-19 इन्फेक्शन के वजह से प्रीमैच्योर लेबर की चांसेस 2 या 3% बढ़ जाती है. और दूसरी एक इम्पॉर्टेंट चीज है कि देयर कैन बी अ रिस्क ऑफ fetal loss at 9 in third trimester. So इसके लिए बेबी के किक मूवमेंट पे, किक चार्ट पे ध्यान रखना बहुत जरूरी है. The third trimester is very important because the chances of mother getting infection with COVID-19 is higher at that point of time. Abhi, let's talk about what one should do if there is a suspicion or of COVID-19 infection. Pregnancy में बुखार आना, आजकल के माहौल में भी, as we used to do hemoglobin, urine test, मलेरिया टेस्ट, उसमें COVID-19 टेस्ट करना भी बहुत जरूरी है, क्योंकि अर्ली डिटेक्शन एंड ट्रीटमेंट इज द की. और घबराने की जरा भी जरूरत नहीं है, क्योंकि 2/3 of these patients are completely asymptomatic or have mild infection. और इनका मेन ट्रीटमेंट यही है कि आप घर पे आइसोलेशन में रहो, have lot of fluids, vitamin C, and make sure that your room is ventilated, and do a regular deep breathing exercises and physical exercises. So these are the main key things. At the same time, you need to observe some important parameters, temperature, pulse oximeter, और suppose आपको breathlessness हो गया, saturation drop हो गए, then you will have to contact your doctor. It's very important to test yourself, because बहुत ऐसी गर्भवती महिला है कि उनको टेस्ट करने में बहुत डर लगता है, क्योंकि मैं पॉजिटिव आ गई तो मेरी फैमिली, मेरे बच्चों का क्या होगा, फिर वो उनको क्वारंटाइन करना पड़ेगा. तो ये डर मन से पहला निकाल डालो, क्योंकि बिकॉज ऑफ द इन्फेक्शियसनेस ऑफ दिस प्रॉब्लम, इट्स वेरी इंपॉर्टेंट आपके खुद के स्वास्थ्य के लिए, लेकिन आपके फैमिली के स्वास्थ्य के लिए, कि ये डायग्नोसिस अर्ली जरूरी है, सो दैट आइसोलेशन और स्प्रेड हम रुक सके. अभी जो लोगों को डेफिनेटली कोविड-19 इन्फेक्शन है, तो मैंने ऑलरेडी बोल दिया है कि क्या करना चाहिए. एट द सेम टाइम आपको ब्रेथलेसनेस हो रहा है, कुछ ज्यादा प्रॉब्लम हो रहा है, सो यू नीड टू कॉन्टैक्ट योर डॉक्टर सो दैट दे कैन अरेंज योर एडमिशन थ्रू कोविड-19 कॉरिडोर. क्योंकि ये अलग तरह की आइसोलेशन ये होता है कि आप जनरल पब्लिक और जनरल हॉस्पिटल के पेशेंट को एक्सपोज नहीं होके आपको मेडिकल ट्रीटमेंट मिले. अभी whether having COVID-19 affects your mode of delivery, यानी आपको फिर सिजेरियन ही करना हो पड़ेगा, ऐसा कुछ भी नहीं है. इफ आप स्टेबल है, सब कुछ अंडर कंट्रोल है, ऑक्सीजन सैचुरेशन अच्छा है, तो आप नॉर्मल डिलीवरी भी कर सकते हैं. बट इफ यू आर क्रिटिकली इल और एंड योर हेल्थ इज मोस्ट इम्पॉर्टेंट, तो उस समय बेबी डिलीवरी करके जल्दी करके हम फिर सिजेरियन करना हमको जरूरत पड़ता है। अभी इसके बाद आफ्टर डिलीवरी का डिलीवरी यानी ब्रेस्ट फीडिंग इज वेरी इंपॉर्टेंट। सो इफ we are all encouraging breastfeeding even if the patient is COVID positive, if it is particularly if she is asymptomatic or mildly symptomatic. So one but the pregnant lady, the patient should follow masking, hand sanitization while breastfeeding, and these are very important things. But suppose, and what are the risks of baby getting the infection from mother during labor and at the time of delivery? So it has been shown it is very, very negligible. So to concise, it's very natural कि ये बहुत स्ट्रेसफुल पीरियड है, ये एवर चेंजिंग सिनारियो है कि क्या सही है क्या गलत है। और एक तो सिचुएशन के वजह से और गर्भावस्था के वजह से जो मेंटल टेंशन आपको हो रहा है, उसका इलाज एक ही है कि आप लोगों से, आपके जो केयर गिवर है, जो ऑब्स्टेट्रिशियन है, आपकी नियर फैमिली है, उनसे कनेक्टेड रहो। आजकल हम आर्टिफिशियल इंटेलिजेंस, सोशल मीडिया, इसके ऊपर बहुत डिपेंडेंट है। सो दैट इज अ बेस्ट वे टू कनेक्ट टू द पीपल एंड टू योर डॉक्टर। सो try to have less physical consultation। हॉस्पिटल जाना है तो उसी समय आप आपके बाकी के सब इन्वेस्टिगेशन यानी सोनोग्राफी, वैक्सीनेशन, डॉक्टर विजिट एक ही समय पे कर लो, सो दैट आपको बार बार क्राउडेड प्लेसेस पे और डॉक्टर्स के पास हॉस्पिटल में जाना नहीं पड़े। एंड टेलीकंसल्टेशन हैज मेड life very easy for the patients, and it also helps us to आइडेंटिफाई कि कौन से गर्भवती महिला को ज्यादा केयर चाहिए और क्या सिम्टम्स है उनको आने की, और डॉक्टर और कोई दूसरी प्रॉब्लम, मेडिकल प्रॉब्लम रहेंगे और ज्यादा सोनोग्राफी करना पड़ेगा तो उसकी जरूरत है, वो भी हम रिस्क असेसमेंट कर सकते हैं। सो बेसिकली हम लोग एज अ ऑब्स्टेट्रिशियन, गर्भवती महिला भी, ये आजकल के जमाने में जो हमारा कोविड-19 और प्रेगनेंसी का केयर प्लान है, बहुत इम्पोर्टेंट फैक्टर है फॉर देयर ओन केयर। सो ये these are the important things which I wanted to tell you at this point of time. I'm going to take some question. Okay, so somebody is asking, so remdesivir is not safe in pregnancy. So there, remdesivir has been used for now almost a year in pregnant ladies, and so far there has not been shown to be any adverse effects. So, and as I said, if the mother health needs it, then one should not withhold these antiviral infections. So Rebecca Prakash is asking, pregnant woman, is okay for pregnant woman to miss scans for COVID situation? So Rebecca, there are some important sonographies which one need to do, like a nuchal scan at 12 weeks or anomaly scan. So these are two important ones, so which should be arranged. But the remaining scans, like growth scans or something else, depending on your need and your risk assessment, you can miss those scans, but you should talk to your gynecologist and talk to them whether it can be postponed for a couple of weeks and things like that. So that has to be an individualized decision. How vulnerable they are to the COVID-19 suspected. Monalisha is asking, with suspected or confirmed COVID-19, need to give birth by cesarean section. I have already said that having COVID-19 infection does not mean that you cannot have normal delivery. It actually depends on how well you are. If you are asymptomatic, mildly symptomatic, then you can have a normal delivery. So there are the risk of transmission of infection to the baby from the mother during through the placenta. That's called a vertical transmission. It has been said that it's between 2 to 3%. It's almost negligible, and if the baby happens to get a COVID-19 infection, they recover completely. So, Akita is asking, should pregnant women test for COVID-19? So, COVID-19 test in pregnancy is indicated twice. First thing, if there is a suspicion of COVID-19, like in current situation, if you're having fever, sore throat, or breathing problems. And the second thing, second situation, all pregnant women at around her due date, let's say 5 to 7 days before her due date, should have a COVID-19 test done. So that's the time one should do COVID-19 test. Deepika is asking, do pregnant women have a higher chance of getting coronavirus infection? So again, I have addressed this. I know it has been said that pregnancy is an immunocompromised state. So that's the reason in pregnancy, pregnant women are vulnerable for infection. But it has not been proved like that. Obviously, your chances of getting coronavirus infection is as same as a non-pregnant woman. So Diksha is asking is I'm 36 weeks here, 36 weeks pregnant, and I'm feeling well. So do I need to go to the hospital for routine checkups and sonography? So coming to this very important question, pre-COVID, we were asking the patients to come very frequently for checkups. So maybe we used to have 8 to 10 antenatal visits, but in COVID this time, in current situation, we are trying to limit these physical visits to 4 to 6 maximum. So depending on problems one have in pregnancy, usually we would ask them to come at 36 or 38 weeks, maybe at 39, and if you don't go in labor, directly at 41 weeks, so that we can start off the labor artificially. Uh, so yeah. So Nibha Kumari is asking, my bhabhi has a 4-month-old son and was born by surgical operation. What precautions should she take during COVID-19 crisis, during health hygiene safeguard from going to a doctor? So as I said, first she really need to check whether she needs to visit the doctor, because 4 month post cesarean, unless a woman has a problem like bleeding or feeding issue, then only one needs to consult a doctor. Most of the time, This thing can be done by teleconsultation. So that's most important thing. So first, try to talk to your doctor whether you need to come and do the consultation physically, and then obviously make sure you be on the appointment so that you don't have to wait long for the in the waiting room for the appointment to take. Then wear mask, make sure your nose and mouth is covered, maybe double masking is very important, and hand sanitization and social distancing is what I would advise to prevent COVID-19 infection. um, so the other question I have is about the time of delivery. So uh, when you are in labor and if you are COVID positive, can the patient have pain relief? Obviously, it is inhuman not to have a pain relief in labor. So it's perfectly okay to use Entonox gas, that we call it gas and air. Then epidural is also safe even if you have a COVID-19 infection. So uh, yeah. I think we are coming to the end of the session, so I would advise you all to take utmost precautions, follow our new social etiquettes of masking, social distancing, hand sanitization. Please, if you are not pregnant at the minute, and if you are adult, whether planning a pregnancy, post delivery, please go ahead and have your vaccination. And please, please remember that early detection and prompt treatment is the key to treat COVID-19 infection. So it's of no use delaying the diagnosis, and be safe, be healthy, make sure that you are physically active and and mentally as well, because this has affected us, our mental health quite a bit. So it's very important to be connected virtually with your colleagues, with your family, near ones, and take care. Thank you.